Welcome to today's lecture on the anatomy and physiology of the upper aerodigestive tract. In this comprehensive course, we will delve into the intricacies of the larynx, pharynx, and upper esophagus. Understanding the structures and functions of these vital components is essential for any aspiring otorhinolaryngologist. So, without further ado, let us explore the fascinating realm of the upper aerodigestive tract. The larynx, pharynx, and upper esophagus are anatomical structures involved in speech, swallowing, and ventilation. An understanding of their complexity and functions is essential for comprehending further lectures on LPR. Laryngopharyngeal reflux, LPR, involves the abnormal reflux of stomach contents into the upper aerodigestive tract, affecting the larynx and pharynx. Incompetence of the upper or lower esophageal sphincter allows acidic substances to damage these tissues, leading to various symptoms and potential complications. Understanding LPR's pathophysiology is crucial for proper diagnosis and treatment. In the video, we discuss how to recognize and diagnose laryngopharyngeal reflux, LPR. Typical symptoms include chronic cough, hoarseness, throat clearing, globus sensation, dysphagia, and chronic sore throat. Diagnostic criteria involve evaluating symptoms, laryngoscopic examination, and reflux monitoring techniques, such as the reflux finding score, RFS, and specialized tests like pH monitoring and impedance testing. Proper recognition and diagnosis of LPR can lead to effective treatment strategies. In order to accurately diagnose laryngopharyngeal reflux, LPR, it is important to differentiate it from other conditions that have similar symptoms, such as allergic rhinitis, asthma, chronic sinusitis, and neurogenic cough. This requires a comprehensive evaluation including history, examination, and diagnostic tests. Laryngoscopy is used to visually examine the larynx for signs of inflammation or other reflux-related issues. pH monitoring measures acid levels in the esophagus, while impedance testing detects reflux episodes. These diagnostic tools help confirm LPR and guide treatment. In the treatment of laryngopharyngeal reflux, LPR, making lifestyle changes and modifying certain behaviors are key. This includes avoiding trigger foods, managing weight, quitting smoking, and implementing strategies like raising the head of the bed and eating smaller meals. These approaches should be the first-line treatment for mild to moderate cases and require patient education and counseling for effective implementation. When lifestyle modifications alone do not provide adequate symptom relief, pharmacological interventions become necessary. Proton pump inhibitors, PPIs, are the mainstay of medical treatment for LPR. PPIs work by inhibiting the gastric proton pump, decreasing acid production and subsequently reducing reflux episodes. Commonly prescribed PPIs include omeprazole, lansoprazole, and pantoprazole. The appropriate dosing and duration of PPI therapy should be tailored to the individual patient's needs. PPIs have proven to be effective in managing LPR symptoms, promoting healing, and preventing further complications. It is crucial to monitor patients on PPI therapy for potential adverse effects, such as vitamin and mineral deficiencies, as well as rebound acid hypersecretion upon discontinuation. In cases where lifestyle modifications and medical therapy fail to alleviate symptoms or in patients with severe or refractory LPR, surgical management may be considered. Various surgical procedures aim to strengthen the lay or repair hiatal hernias to prevent reflux. Fundoplication, a procedure that wraps the upper part of the stomach around the lay, is one of the most common surgical interventions for LPR. Surgical management of LPR carries potential risks and complications. Therefore, a detailed assessment, including an evaluation of the patient's comorbidities and preferences, should be conducted to determine the most appropriate course of action. LPR, if left untreated or poorly managed, can lead to various complications, including chronic laryngitis. Persistent inflammation of the larynx may result in vocal cord nodules, polyps, or even scarring. Recurrent respiratory infections. Aspiration of gastric contents can cause recurrent infections, such as pneumonia or bronchitis. Barrett's esophagus. Severe and chronic LPR can lead to changes in the esophageal lining, increasing the risk of developing Barrett's esophagus and esophageal adenocarcinoma. Understanding the potential complications associated with LPR emphasizes the importance of early diagnosis and appropriate management to prevent long-term sequelae. LPR is not solely confined to the upper aerodigestive tract, as it can manifest in various extraesophageal sites. The association between LPR and extraesophageal manifestations has been extensively studied, with evidence suggesting connections to chronic cough. LPR is a recognized cause of chronic cough, particularly when other etiologies have been ruled out. Asthma, reflux-induced microaspiration can exacerbate or trigger asthma symptoms. Dental erosion, Acidic refluxate can result in dental enamel erosion and subsequent tooth damage. Recognizing the potential extraesophageal manifestations of LPR is vital in providing comprehensive patient care and ensuring optimal treatment outcomes. Laryngopharyngeal reflux, LPR, in children presents with unique challenges. Diagnosis requires a thorough history, clinical evaluation, and involvement of pediatric specialists. Treatment involves lifestyle modifications, dietary changes, and medication in severe cases to optimize outcomes in pediatric LPR management. The field of LPR research is constantly evolving, with ongoing studies investigating novel diagnostic techniques and therapeutic modalities. Emerging research suggests the potential use of non-invasive biomarkers, such as specific protein levels or genetic markers, to aid in the diagnosis and monitoring of LPR. Additionally, targeted therapies, such as neuromodulators, may offer new avenues for managing refractory cases. While further research is required to validate these emerging approaches, they hold promising potential for improving the diagnosis and treatment of LPR in the future. To summarize, understanding and managing laryngopharyngeal reflux involves knowledge of anatomy, diagnosis, treatment, and potential complications. Staying updated on research is crucial for optimal patient care.